Hi friends, welcome to our YouTube channel Nurses Forum. We all are familiar with the Glasgow Coma Scale scoring system. Today we will see what exactly it is and how we can assess the neurological function of a patient with this Glasgow Coma Scale. Glasgow Coma Scale is a neurological assessment tool for determining the severity of patient's brain dysfunction. By using this GCS score, we can assess the neurological function of a patient. Previously, it was used only for assessing the level of consciousness, but in the modern time, it is being used for critical and trauma patients for assessing the neurological functions along with the level of consciousness. This scoring system composed of three parts. What are the three parts? These are eye response, verbal response, and motor response. The minimum score awarded for eye response, verbal response, motor response is 1 each, and the maximum score for eye response is 4, verbal response is 5, and the motor response is 6. We will get the total GCS score by adding this eye response, verbal response, and motor response. For the minimum GCS score is 3 and the maximum GCS score is 15. We have already discussed GCS scoring is used for assessing the neurological function of a patient. So by using this GCS score, we can classify the level of brain injury as well. In the case of GCS score is less than 9, we can say it is a severe head injury. If the GCS score is in between 9 to 12, we can say it is a moderate head injury. Or the GCS score is in between 12 to 15, we can came to the conclusion that it is a mild head injury. So by using this GCS score, we can classify the level of brain injuries like severe, moderate, and mild. If the GCS score is less than 10, it is severe. If the GCS score is in between 9 to 12, it is a moderate level of head injury, and it is in between 12 to 15, it is a mild head injury. Now let us see how we can assess the GCS score by using eye response, verbal response, and motor response. First, let us see the eye response. If the patient opening his eyes spontaneously, eye open spontaneously, the score is 4. If the patient is opening his eyes only to verbal stimuli, for example, if you are calling the patient or asking the patient to open his eyes, if the patient is opening his eyes to a verbal stimuli, that is, the score is 3. If the patient is only opens to painful stimuli by giving pain to the supraorbital notch or on the trapezius, if the patient is opening his eyes, then the score is 2. That is, if we are giving a pain to the patient, that time only the patient is opening his eyes, then the score is awarded is 2. If the patient is having no response to pain stimuli, to verbal stimuli, then the score awarded is 1. That is the eye response. The maximum score is 4 and the minimum score is 1. Minimum score is 1. Eye open spontaneously, the score is 4. If the patient only opens to the verbal stimuli, it is 3. If the patient is opening his eyes only to the painful stimuli while we are giving pain on supraorbital notch on the trapezius, then the score awarded is 2. If the patient is having no response, the score is 1. Now we can coming to the verbal response. The first one is the patient is oriented. Then the score is 5. Patient is oriented to day, time, and place. While we are asking the patient to what is the time now and what is your name, the patient is giving the correct answer. Then we can say patient is oriented to day, time, and place. So the patient will get a score of 5. In the second part, if the patient is in the confused state, the score will be 4. We are asking the patient to any questions like what is the date now, what is the time now, and the patient is confused. So we can say the patient is in the confused state, and the patient will get the score of 4. In the third part, if patient is saying inappropriate words while asking the patient name or while asking any questions, the patient is producing only some words like hotel, food, like not relevant to the situation. But not relevant to the situation. Patient is not able to provide a proper sentence. He is telling only a words. Then the score awarded is 3. If patient is making only a incomprehensible sounds like like that, while we are asking to the questions, patient is not able to produce even a words or patient is fails to make any sentences. Patient is only making some sounds like some sounds. So the score awarded is only 2. If the patient is having no response, so the score is 1. So the minimum score awarded is 1 and the maximum score awarded for the verbal response is 5. Now we can go to the last part, that is motor response. In the motor response, the maximum score is 6 and the minimum score is 1. Let us see the first part, that is obeying commands. If patient is obeying our commands, the score will be 6. For example, we are asking the patient to protrude his tongue, or we are asking the patient to raise his hands. If the patient does so we can give the score of 6. If the patient is localizing the pain while giving a pain onto the supraorbital notch or onto the trapezius, patient is doing a purposeful action or purposeful movement to remove the painful stimuli, then we can say the patient is having the score of 5. If the patient is withdraws to the pain, that means normal flexion. If we are giving a pain to the patient tries to remove the painful stimuli, but he fails to localize the pain. Patient is trying to remove the painful stimuli. Patient is not able to localize the pain. Patient cannot able to raise his hands above the clavicle line. And then we can say patient is having only a normal flexion, having only response to withdraws to the pain. Then the score awarded is 4. Then next we can see the abnormal flexion, that is decorticate movement. The patient is, while we are giving to the painful stimuli to the patient is having only an abnormal flexion, that is decorticate movement, flexion at the elbows or flexion of forearm and wrist. Then we can say the patient is having a AM3 response, that is motor 3 response. So the next part is patient is having an abnormal extension. While giving your painful stimuli, patient is having an abnormal extension, decerebrate movements. Then the score awarded is motor response 2. That means patient is having a response at the extension at elbows. Having only an extension at elbows, there is no flexion. There is no flexion response. Patient is having an extension at elbows. Then the score awarded is 2. If patient is having no response, while we are giving to the painful stimuli, patient doesn't have any kind of response, then the score is, we can say the patient is having M1 response. This is an image of M2 and M3 response, that is decorticate movements and decerebrate movements. In the decorticate movements, patient is having flexion at the elbows and flexion on the arm and the wrist. Then the score is M2 response, M3 response. This is the image of a decorticate movement. And then the second part is the decerebrate movement. Patient is having extension. The difference is between the flexion and the extension. In the decerebrate movement, patient is having the extension at the elbows. Flexion is same here in the both image. Flexion will be there in the arm and wrist in the M2 and M3 response. But the difference, you can see the response at the elbow region. In the M2 response, the extension will be there, and in the M3 response, that is the decorticate response, patient is having the flexion at the elbows. One of the important thing we need to keep in our mind before doing a GCS assessment score is we need to make sure that the patient is not having any hearing impairment, or the patient is not in under sedation, or the patient is not having any paralysis. This we need to keep it on mind before these all things before doing a GCS assessment. Or one of the another important point is, if the eye response is interfered due to some local factors, like patient is having any eye injury, so while doing the eye response, we will face some issues. So in that condition, we are not able to assess the eye response. In that situation, we need to write it is not testable, like NT. The same thing we can apply to the verbal response also. If the patient is patient is on intubated situation, or the patient is in tracheostomized, in that condition also the patient cannot give a proper verbal response, so we can write it is VT or not testable. The same thing like motor response also. If the motor response patient is in a paralyzed condition, the same thing happen here also. We can write not testable like NT. So friends, this is all about the GCS score and we are dealing with so many patients in our clinical practice with neurological disabilities and head injuries. So it is very important to know the GCS score and what is GCS score and how we can do the neurological assessment of a patient with a GCS score with a Glasgow Coma scale. Thank you. Thank you for watching this video.